Hi, Tony Tonkin here from the Child Protection Party. I wanted to make a comment today about the new national children's mental health and wellbeing strategy, which has been launched today by the Australian government. There's a few things I want to mention, some of them in relation to children's mental health in particular and how important that is. But before I go into that, and also the impact that it has in terms of the child protection system and those kids that are in care, I just wanted to talk a little bit about what this strategy, this particular program or strategy looks like. So in order to do so, I just wanted to quote something that the Minister has said, and then we'll kind of go from there, I guess. So he says, caring for the mental health and well-being of our young people, of our young children, especially during the COVID-19 pandemic, is critical. We know that proper support can improve long-term outcomes and can help children achieve their full potential in life. To ensure that every child has the opportunity to grow up in a healthy and supportive environment that helps them and their families and communities to thrive, we need a mental health and wellbeing system that is well designed, comprehensive and nationally consistent. This strategy shows us how and will be crucial to our current ongoing reform of the mental health and suicide prevention system. It is about ensuring the best for our children at each and every step, and I'm honoured to launch it today, he says. Now, I think it's important for us to understand that it's important for us to have, we should always have had a mental health strategy for kids. So to be sitting back now and celebrating the fact that we've decided to do it kind of is a little bit after the horse has bolted. But I guess it's better late than never, and we at the Child Protection Party will certainly support the notion that a mental health strategy for children is important. This particular mental health strategy is for children under the age of 12. So I'm assuming then that the Department of Health has acknowledged the fact that they have some form of mental health strategy for children that are older than 12. Heaven only knows what that looks like, but at least they're making the effort to recognise the younger children and how their mental health suffers and so forth. So we'll just have a look a little bit at the way this is supposed to look and in what areas. So through 4 focus areas, the strategy outlines the requirement of an effective system of care for children. 1, family and community. 2, service systems. 3, educational settings. 4, evidence and evaluation. They go on to say, so this is the Assistant Minister Coleman says, half of all adult mental health challenges emerge before the age of 14, yet few people below the age of 12 receive professional support. As a nation, we need to acknowledge this and do everything we can to change it. Our government is committed to the task. This is the first time a national government has developed a strategy that considers mental health and well-being of our children, as well as their families and communities who nurture them. And then they list the amount of money that's being spent on this, which who knows whether it's a significant amount or not, because I don't. 54.2 million to create new Head to Health Kids mental health and wellbeing centres for children up to 12 years in partnership with the state and territory governments. 52.3 million to support access to parenting education and support, to build parenting strategies and help parents to identify problem behaviours early. Now, I just need to say that in relation to that second point where they're spending $42.3 million to support access, we don't yet know what that looks like and how they're going to go about implementing that. But it's certainly something that I support. For years, we've been saying at CPP that, in fact, they need to have a system which assists parents to understand what it means to be a parent. And now, and every parent, first-time parent, I think, should be requested to attend some sort of parenting course so they can better understand how it is that they need to parent. We know from our experience in CPP that most parents, when they become in contact, particularly with the child protection system, it's then that they're told that they are crappy parents and need to find better ways to parent. Now, I believe that we'd probably have fewer kids in care if parents undertook appropriate courses to learn how to parent and also to deal with the issues that may cause their children to be removed in the first place. But there are lots of parents out there who have mental well-being problems. They live in a domestic violence relationship, that sort of stuff, that aren't impacted by the child protection system, but who have issues in their lives that certainly impact the way that they might choose to parent. Now, when we're looking at the overall health of young children, we need to consider that it's the environment in which they live that creates most of the issues that many of these kids wind up having to face in adolescence and later on in adult life. So it's in these early stages that we need to find a solution. We know that the impact that the first 1,000 days of a child's life have on them. And we also know that it's the environment in which they live within those 1,000 days that is going to determine how they feel about themselves and will actually impact their mental well-being later on. So it's important to understand that even though we have these strategies, the point is, how do we get people engaged in them? We know that most people don't tend to get engaged in these types of services until such time as they're told to by authorities. So finding ways to engage people, I think, is important. I'm not too sure what their specific strategy is in that particular area. However, they go on to say 26.8 million support kids helpline and meet the increased demand for services, 47.4 million of parental mental health initiatives, perinatal mental health initiatives, and I think that's pretty important. 111.4 million to allow family members and or access to it, or carers to access up to 2 of a patient's available Medicare subsidised psychological therapy sessions, to expand access to group sessions where appropriate. And I think that last one is pretty important. At the moment here in Australia, where psychologists are struggling, or people are struggling to get appointments with psychologists. That's just simple truth. Now, people can access, people such as myself, for example, who are accredited mental health social workers. We're Medicare based, so we can charge through the Medicare system. And there's plenty of social workers such as myself that are available to be able to work with families. In fact, in many ways, I believe social workers are probably more equipped for that than a lot of psychologists. But however, I'm sure some psychologists will come back and tell me that's not the truth. There are lots of good people out there in all professions, I guess, who are available. And the issue too has been that I think one of the primary problems around kids' mental health is that we've been living for the last 2 years in troubled times. Parents have been stressed about work, about COVID, and how they can actually deal with that if they actually become infected themselves. Families that are infected, how that impacts their kids. We've heard many stories of families having to be separated while parents are in hospital. But generally out there, I think kids are kind of concerned about how to deal with this problem that they can't control, that their parents can't control, and that everybody around them feels anxious. The environment has changed, just in terms of people having to wear masks all the time, and kids are finding, for a lot of young kids, perhaps a lot of this will become normal, but for our older kids, this is different. This is new, and it's a fearful environment in which to live. And one of the issues I think that they raise, which I think is really important, is how do parents identify what's happening for a child when they're struggling. So one of the examples that they did mention in one of the videos I saw was that if a child says, I've got a sore stomach, is that about the sore stomach something that they've eaten, or is that a child finding a way to tell you that they're feeling anxious or stressed? So the point is, we need to look at the signs that we get from kids about how they're thinking, how they're feeling, and then we need to find ways to address that and find ways to have conversations with them. Now, a lot of that depends on the type of relationship we have with our own children, where if we're able to listen to kids, if we're able to have a relationship whereby they feel comfortable communicating with us about what's happening for them, then we're better off as a parent. They're better off as kids because we can find out actually what's happening for them. But also we must remember that there are often language barriers in terms of a child's own development, their ability to be able to communicate with us as to what's happening. Don't assume that because a child is saying they have a sore stomach, that it is just about a sore stomach. Let's find out also about how kids are functioning at school, whether they're being bullied, whether and an indication often is if you've got a relatively smart kid and for some reason they don't want to go to school, or their work seems to be suffering in some form or another, or they seem to be slipping behind, often something's happening for them that causes that, and we need to find out what that is. So there's a lot of work that we need to be doing in relation to building a child's better sense of self. Now, I celebrate the fact that we've got this strategy. They're touting it as the first in the world. I doubt that. I must have a look at some Scandinavian countries to prove that or not. But at the end of the day, it's something, and at least they're doing it now. And I just wonder whether COVID was the reason why this has happened. COVID might have kicked it along somehow. The other area too that we at CPP are concerned about is the mental well-being of kids in care. Because that's poor, that's shitty, and we've known that for years. Yet the government doesn't seem to evaluate their involvement in a child's mental well-being by simply removing them from their families. How does that impact a kid? What sort of traumatization does that cause? So we've got kids in mainstream society who are dealing with the stresses, as I've just discussed, and then we've got kids in care who are dealing with a completely different set of stresses, another layer of stresses on top of everything that normal kids are experiencing, I guess. And and yet those issues are not addressed in any way. In one of the studies, they're saying they're putting $111.4 million to allow family members and or carers to access up to 2 of patients' available Medicare subsidies, psychological. So up to 2 of a patient's available Medicare. So I guess that's doubling the amount of Medicare allotted appointments that a person can take. So that probably pushes it up. I think they're about 20 now. So there's plenty in there to be able to provide additional services for kids. And the thing that I would like to suggest is, I'm sidetracking a little bit, but parents are the ones that need to seek the help because they're the ones that are going to find different strategies to deal with kids that are struggling. And I think the day's over where we look at a kid and we identify them as being on a spectrum of some sort, and we say, okay, they're on the spectrum, therefore I need to put stuff into place with regard to Asperger's or whatever. And instead, we need to start looking at the core problem, which is often the parenting. And I know a lot of parents don't like me saying that if a kid's got an issue, sometimes those issues are about us as parents. ADHD is a really good example of that, I think. There's plenty of proof to say that ADHD, well, does it exist? Well, I don't know. We can't do a blood test to prove if it exists. So it's a very subjective view of whether a child is functioning appropriately or not. But many of the cases that I've seen in regard to attention deficit hyperactivity disorder basically are around a parent's parenting. So we need to find better ways of parenting. Fine. As a state, though, we need to find better ways of caring for kids because we are adding to the problem that we experience in terms of mental well-being amongst kids that are in care. So they're my thoughts on this new strategy. I'm excited to see that the government's putting more funding into it. We at the CPP support this, obviously, because it's around enhancing the well-being of kids. But there are a lot of sort of things we need to be wary of. Number one, where does this money go? How's it being utilised? Is it being utilised in the appropriate areas? If you want to go and get a counsellor and you want someone to look at what's happening for your kids, go to social workers, find accredited mental health social workers. There are plenty out there who will be able to provide the services that you require. In my case, I certainly do outreach work, so I go and see many of the people that I work with. So have a conversation with somebody about what's happening for your kids. That's what's important. The funding is now there. Those services will be available, I guess, soon, if not already, and make the most of it. But this is a good initiative. Let's work the best we can to improve the well-being of our kids. Because remember, our children are going to grow to be adults, and the environment that they have when they turn adult, when they become adults based on their past, is going to determine how productive they are and the contribution that they make to our society. So thanks everybody for being with me. Take care, look after yourself, and more importantly, look after your kids and be safe.